everyone. I am Razvan Trashku from Aslan International Foundation. I'm happy and honored to start the presentation today about the features of the dashboard and a short presentation of the patient onboarding flow for the SmartBear project. So of course, after going through the initial stages when we are presenting the main features to the participant, we have to obtain the consent form and present the confidentiality policy and get their agreement for processing the personal data as part of dashboard inputs. Then we have a first stage of going through the screening process when we actually have to fulfill just 2 criteria, and the dashboard is very intuitive and useful in doing that. After that, we start filling up the details about the initial assessments and about the dedicated assessment for the comorbidities that made the participant eligible for participation in the SmartBear project. Of course, our clinicians at first bickered about having to input such huge amounts of data into the dashboard, but they soon came out to the conclusion that it's a very smart way of presenting and integrating clinical data. Of course, this comes to complement the failures, if you will, of the Romanian electric health records, because that's mostly focused on billable services for the participant, and having an option to present all the relevant clinical data in a unified way is, of course, hugely helpful. There was a brief demonstration of how setting up the pairing kits were meant to happen, and it was showcased for the Romanian pilot by my partner Claudiu Petrescu from ITSS by proving how to actually demonstrate how to actually pair the smartphone and oximeter, and we just showcased how to actually generate and send values into the dashboard. After that, as a peculiarity and particularity of the Romanian pilot, we had to have signed contracts for the deployment of devices with each one of the participants.
Hello everyone, so please first let me introduce myself. I'm Maxime Bezlin, I'm the project manager of SmartBear for the French pilot. I'm here today with Christelle Roland, which is managing the project with me in France, and also Professor Frédéric Bloch, who is at the head of the Geriatric Hospital of Amiens, University Hospital of Amiens. Today we are going to present you the SmartBear project from the point of view of a participant who is using the devices and the application to follow his own health values. So in France we succeed in having over 800 volunteers who wanted to join the project, and also over 400 participants were included in this project and had a full assessment. We have to capitalize on what we've learned, on the knowledge created during this project. So, as my colleagues say during the video that were presented in our booth, we have to use this extensive network of stakeholders, clinicians, to promote and to disseminate the use of digital technology and innovation for the benefit of elders and also for the physician.
Good morning, I'm Canela Carampela. I'm the Head Director of Public Health and Social Welfare Department in the region of Peloponnese. Peloponnese has consistently adopted strategies, policies aimed at support health promotion, and digital transition is a major driver to for the services transformation, especially for the elderly one.
Good morning, we're the Greek pilot, which consists of 2 sites, municipality of Paleophalliro and region of Peloponnese. Greek pilot managed to recruit 958 participants from 1,138 enrolled elders, and totally delivered 5,450 used devices.
Hello, this is Dimitrios Boucharas from University of Ioannina, a data scientist and AI engineer. Today I'll present you the HoloBalance Telerehabilitation program that lasts about 8 weeks and tries to assess the issues with balance disorders for the elderly in the SmartBear project. It's a synergy project, so the solution takes cutting-edge technology like smart insoles with 16 pressure sensors and give us also acceleration signals, as well as inertial measurement units that contain accelerometer and gyroscope in order to get data from their posture, and 2 of those are placed at the forehead and 1 at the back. The solution will try to assess the performance at the start and then see if there are some clinically valid results and outcomes for the physicians. In terms of the SmartBear synergy, we also derive the metrics and all the insights and graphs to the SmartBear dashboard.
My name is Yannis Fostiropoulos and I'm the mayor of Paleophaleiro municipality. So now we are at the end of the program of SmartBear and we are very lucky that the Greek pilot, which is the prefecture of Peloponnese, region of Peloponnese and municipality of Paleophaleiro, had already find the target, and the target was correct because now we have the devices, now have the knowledge, and we can continue the program because we already have discussed it with the region of Attica and the Ministry of Health.
The Italian pilot have been implemented in 2 different sites, the Madeira hospital in Milan and the service in Crema, that is a small city south of Milan. And I think there are like a couple of lessons to be learned from the result of this pilot. One lesson is related to the fact that the SmartBear platform provided important instruments in order to organize and plan the territory. So the policies that you want to apply in the territory. For example, we have one indicator that is the intrinsic capacity, that is an holistic indicator describing the health status of a patient. And these indicators have been very useful in order to study, for example, subpopulation inside the territory and to understand the impact of specific recruitment actions and recruitment activities. Another lesson that we learned is related to the fact that SmartBear can be a very effective factory in order to test models, because the capabilities that the SmartBear platform have to collect data into cloud and to analyze those data through a big data analytic environment is very useful in order to create an interaction between the clinician and the data scientist in identifying new models, prognostic models, analytical models in general that can be very useful in order to understand more about your data and about your patients.
So we are now closing this round of demonstrations, and the final part was actually the Portuguese pilot here that we have behind us. The Portuguese pilot has the unique differentiating factor that we have enabled the link with the regional health system of Madeira. So basically all the data that was collected from the participants, the 500 participants that we had enrolled, is now available in the regional health system of Madeira, so that doctors, general practitioners, during appointments can look at the SmartBear data and extract some meaningful information during the appointments with the patients. We had today a doctor here with us. We had also a patient to simulate somehow an appointment and see how the things worked.
This Portuguese pilot was very beneficial for our clinical teams. We could assist and monitor the elderly with several comorbidities, the ones that are most prevalent in Madeira. It was a way for our clinicians to follow them through the wearable devices and medical devices that were provided and assist them in every way that they they could by following the measurements that we're taking at home, and also assist them in their daily practice. It was also a great project to increase health literacy, and the participants felt a lot of changes within their daily life and well-being, making them acknowledge of the health issues that they were suffering, and helping them also to address them and to make better decisions, supported by our clinicians that were ready to intervene every time that was necessary.
I would like also to say that another big achievement in our pilot, which was also demonstrated today, is the fact that we can also provide data directly to the patient's phone upon his or her request. So in a consultation, the patient can say, well, doctor, please, can I have this data with me? Let me take it. And so we have the capability of sharing the data. So the patient receives the data in his phone, and using the synergy that we had with the Smart for Health project, which ended some time ago already, but some of the modules remain active. Using the Smart for Health application, he can share the data with other doctors, with even outside the country, and with trusted members of his family, for example, to support him when in case he's not capable of showing the data himself. And I think also this is a very interesting result that potentiates also the future activities in health data sharing throughout Europe.
So SmartBear for sure will stay with us. Our community is pretty much engaged in these activities, and will continue to perform them, to have and to benefit from a better healthcare provision.